We're going to do an abdominal assessment. You start out, you want to just inspect the abdomen for any masses, lesions. You want to notice the contour of the abdomen. Look for any venous prominence or pulsations. You can check for diastasis. You ask the patient to raise her head like that. Okay. Then we'll auscultate, listening for bowel sounds. We'll listen for bruits over the iliac and renal arteries. We'll listen to all 4 quadrants. And we need to percuss over the area of the abdomen for overall sounds of dullness or tympany. And then we'll individually percuss over the liver and spleen and the stomach. So start at the mid-clavicular line and go upward to find that inferior border of the liver. Well, that's why I didn't see that. Right there. Oh, yeah. What are you looking for? When you're percussing for the liver, you'll use a marker and mark your borders. For percussing the spleen, you want to go to the left side, just posterior to the mid-axillary line. Listening for the dullness. Pressing for the stomach, you want to go to the left, anterior. Do not listen for bruits into the iliac or renal arteries. So now I'm going to listen for bruits at the iliac and renal arteries. So we would go just below. I'll be right about here. Here for the renal arteries. Which I hear none. So we'll palpate the abdomen for masses and do light palpation, moderate palpation, and deep palpation, feeling for the organs also. Over to moderate palpation. Deeper palpation is used to feel less obvious masses and better feel the organs. Of course, you should always be aware of tenderness. You don't want your patient to be in pain while you do this. And that is our abdominal assessment. Okay, so I know this is kind of out of order, but we're going to go ahead while Mallory's laying. We're going to go over some musculoskeletal areas, hip rotation, and things like that. We'll check for hip rotation, internal rotation. We want to that way, and then external rotation. You can also, at the same time, for hip and knee extension, flexion, internal rotation, then we have Mallory roll over onto her belly. Oh, I didn't. We'll check for dorsiflexion, plantar flexion, inversion, eversion. Now we look at posture, distribution of weight, her position of her feet, and then have your patient walk across the floor and back just a few steps if you want to do that, to check for gait and stability and balance. We'll check the mandibular joint. We'll open and listen for any clicks and move from side to side. And there is some clicking going on there. I'm going to return. I'm going to look at her spine. Make sure it's straight. Palpate. Awesome. I'm going to have Mallory bend over. Okay, now touch your toes. I'm going to try to visualize the spine. Make sure it's good. Okay, stand back up. Here we're going to look at the upper body and hang your arms straight and bring them up in front of you and then back behind you. So flexion and hyperextension back here. And then we're going to have her bring her arms across and back behind her, across the back. There you go. Same thing with the other arm. And do external rotation. Put your hand behind your neck and move your elbow to the front and then back. And the other side. Okay. And now I push against my hands with your shoulders. Okay. And down. Let's see. Now look for rotation of the check extension and flexion of the neck. Flexion and extension. And then we're going to do rotation, left and right. And then lateral bending, we're going to have you tilt your ear to your shoulder. Other side. I'm going to have Mallory try to resist me pushing her head back and then to the back also. And from side to side. That's good strength. Inspect the hands. Palmar and dorsal. Both. And flexion and extension of the fingers. I'll have Mallory squeeze my hands. Check for strength. I'm going to have you push away. And then I'm going to pull. Try to pull. Okay. Now look at the extension and flexion of the elbows. The same, could have done that with the shoulders. That's the musculoskeletal assessment.